Hello and welcome to this month's Supporting Client Health and Wellness class. My name is Katie Taylor and I am a nurse here at Far Northern Regional Center. Also with me are my fellow nurses Jennifer Badger and Nellie Camarena. Today's presentation is on cerebral palsy, and I will talk about what cerebral palsy is and medications you may see for your clients with cerebral palsy and what are potential side effects with each of those medications, things you should consider as a care provider, and potential complications for people living with cerebral palsy. Next slide. Cerebral palsy is a group of neurological disorders that appear in infancy or early childhood and permanently affect body movement and muscle coordination. It's not a progressive disorder, meaning it won't get worse as a person ages, but it may present differently as the person ages. Individuals with cerebral palsy are generally diagnosed by the age of 18 months, but sometimes diagnoses are not made until a few years after birth. And just an interesting note, the average life expectancy for a person diagnosed with cerebral palsy varies wildly from as young as 30 to as old as 70 years of age. And that depends on the severity of the condition, as well as any other associated conditions. Next slide. So according to my child at cerebralpalsy.org, there are 4 causes of cerebral palsy, and they're cerebral dysgenesis, hypoxic ischemic encephalopathy, intraventricular hemorrhage, periventricular leukomalacia. And I know those are really big words. I will get into what each of those are here in just a little bit. But basically, it's a result of damage or malformation of the brain during the prenatal, childbirth, or period shortly after childbirth. Next slide. So I'll start off with cerebral dysgenesis, which simply put is brain malformation or abnormal brain development. The brain might end up not developing completely, or it might grow abnormally. It may not be organized in the usual manner, or it may grow and develop and organize, but fail to divide into 2 hemispheres. These types of malformations can be caused by several things, including genetic mutation, infections, fever, or trauma. Genetic mutations, especially ones that occur early in pregnancy, can result in abnormal development or malformation, as the cells containing genetic mutation with the error may continue to proliferate, creating successive generations of cells with that error, which can potentially have catastrophic effects. When this happens in the brain, it could potentially result in cerebral palsy or other disorders. When it comes to infections, an infection in of itself may stop cells in the brain from dividing and differentiating as they're supposed to. Differentiation is the process in which the stem cells change from one cell type to another. There are some infections that are more serious than others when acquired during pregnancy, and it's one of the reasons why doctors are very specific about what foods moms should be eating, making sure hand hygiene is done appropriately. So I'm just going to go over a few of these infections that are typically pointed out by, I would say, OBs as viruses or infections to be very wary of. The first is cytomegalovirus, which is a viral infection that presents as a mild flu, but sometimes doesn't have any symptoms at all. It is spread through contact with bodily fluids that have the virus in it. So hand washing is really important to avoid picking up this virus. It's fairly common in children, as 1 in 3 children have been infected with this virus by the age of 5. And over 50% of adults have contracted the virus by the age of 40. And once a person has been infected and recovered, the virus can reactivate later in life, or you may contract a different strain of the virus. So the best prevention is proper hand hygiene, especially after interacting with small children. The rubella virus, or also known as German measles, is spread through droplets when a person coughs, sneezes, and it initially presents as a rash on the face. This viral infection presents the greatest danger during the first 12 weeks of pregnancy, and the chances of malformation greatly decrease after 12 weeks and practically disappear after 20 weeks. The risk of contracting the virus can be significantly reduced when the mother has already received the MMR vaccine at least 4 weeks prior to pregnancy. If a woman has not received the MMR vaccine, she is not to get one during pregnancy, as it is an attenuated live vaccine and can cause complications. CRS, or congenital rubella syndrome, can cause a wide host of complications, including deafness, cataracts, heart defects, intellectual disabilities, liver and spleen damage, low birth weight, skin rash at birth, glaucoma, thyroid and other hormonal problems, inflammation in the lungs, and of course, brain damage, which could result in the development of cerebral palsy. Next up is herpes simplex virus, which is divided into two different types. Herpes simplex virus 1 causes oral herpes and is contracted with contact from saliva of an individual who has been infected with the virus. That's why it's very strongly recommended to avoid or restricting individuals from kissing infants. The other herpes simplex virus is number 2, and that is the virus that causes genital herpes, and it's contracted through sexual contact with an infected individual. It is highly unlikely that the fetus will contract the virus during pregnancy. However, during birth, the risk for contracting the virus is there, and it might actually cause cerebral dysgenesis, or that malformation during the newborn period. Another sexually transmitted disease that can cause serious complications is syphilis. It's a bacterial infection that if the mother has contracted prior to, during, or during pregnancy, it can cause severe complications. Because it's a bacterial infection, the treatment is penicillin G, and it's the only known effective treatment for fetal infection and preventing congenital syphilis. If the baby contracts syphilis in utero, it can result in miscarriage, stillbirth, prematurity, low birth weight, neonatal death, deformed bones, severe anemia, enlarged liver and spleen, jaundice, skin rashes, meningitis, or brain and nerve complications. And these brain and nerve complications can result in the development of cerebral palsy. Next is toxoplasmosis, which most people associate with the cat pox. It's caused by a parasite that can be found in undercooked and unwashed fruits or vegetables, contact with dirt or sand, contact with stray cats, or it can be found in cat litter or feces, which is why pregnant women are cautioned against cleaning litter boxes. The infection may or may not cause symptoms in the mother, but may still cause complications in the fetus. The risk of transmission from the mother to the fetus are low in the first trimester, but by the third trimester, a pregnant woman with the infection has a 60% chance of passing it on to her baby. And the infection can cause miscarriage, stillbirth, preterm birth, eye infections, problems with the liver and spleen, seizures, convulsions, hydrocephaly, which is fluid on the brain, swollen lymph nodes, macro or microcephaly, so that's either a very large head or a very small head, difficulties with feeding, low birth weight, skin rash and bruising. And this infection can be treated with antibiotics, but the specific antibiotic will be determined based upon how far into the pregnancy the mother is. And then the last one I have on here is varicella virus, which is also known as chicken pox, and it can cause severe and lasting brain damage. This can be prevented if the mother is inoculated prior to pregnancy or has already had a resolved chicken pox infection as a child. If she's not had the infection or vaccine prior to pregnancy, she should not get the vaccine during the pregnancy, as it is also a live attenuated virus. If the mother does contract chickenpox during pregnancy, she needs to be seen by a medical provider immediately to start antiviral therapy. If the virus is acquired during the first 20 weeks of pregnancy, it may increase the risk of the baby acquiring congenital varicella syndrome, which can cause severe birth defects in the arms, legs, brain, eyes, GI tract. It can cause scars on the skin and low birth weight. If the virus is acquired either 2 weeks prior to or 2 weeks after pregnancy, the infection for the baby is usually pretty mild. However, if it's contracted between 5 days before birth up to 2 days after birth, it may result in a life-threatening condition called neonatal varicella, with a fatality rate as high as 30% without antiviral treatment. The infection in the newborn can cause hepatitis, which is inflammation of the liver, pneumonia, and/or encephalitis, which could result in cerebral palsy. And I didn't include it on the slide because studies are still fairly new, but it appears that the contracture of COVID during pregnancy doubles the risk of development of neurodevelopmental disorders within the first year of life. So the standard risk is 3%, but with the contracture of COVID during pregnancy, it goes up to 6%. And the risk of these disorders appears to be the highest when the mother contracts the virus during the 3rd trimester. And studies have shown that the COVID vaccine decreases risk of transmission of COVID to the fetus, and it is actually safe to give during pregnancy and, of course, as well before. So those are the infections, and I wanted to talk a little bit about fever and then trauma. So fever during pregnancy activates immune response in the mother, which in turn triggers the inflammatory response. And that can end up releasing cytokines, which are a normal part of the immune response. And it's thought that those cytokines can cause lesions on the white brain matter. And additionally, that inflammation could lead to decreased oxygenation to the developing brain and cause trauma or cause cellular death or damage. And in regards to trauma, any sort of trauma sustained during pregnancy has the risk of decreasing the oxygen supply through the placenta, which can result in neural damage and ultimately result in cerebral palsy, among other conditions. So next slide. So hypoxic ischemic encephalopathy, also known as HIE, is a brain injury sustained due to limited blood flow during the prenatal and antenatal period. As a result, a baby may develop neurological or developmental disorders that can follow them for the rest of their lives, including cerebral palsy. There are many different situations that can result in HIE, including medical negligence, cardiac complications, placental abruption, which is when the placenta partially or completely detaches from the uterine wall, a prolapsed umbilical cord, which significantly or completely restricts blood flow to the fetus, the stress of labor and delivery, maternal hypotension or hypoxemia, so low blood pressure or low oxygenation, umbilical cord complications such as malformation or restrictions. Sometimes a stricture can happen where blood flow gets decreased, intrapartum hemorrhage, prolonged labor, trauma to the brain or skull of the neonate, congenital brain defects, maternal diabetes, malformed lungs, preeclampsia or hypertension, abnormal positioning of the fetus, apnea or interrupted breathing, and or uterine rupture. And I just want to make sure that I point out that just because one or more of these conditions is present before, during, or after birth does not mean that the fetus will develop HIE or cerebral palsy. It just does increase the risk. So symptoms of HIE in an infant include seizures, which may be resistant to treatment, dilated pupils, a decreased or no reaction to stimuli, irregular breathing, absent reflexes, irregular blood pressure, stupor, or even coma. HIE is generally confirmed with an MRI or like an acidotic pH of arterial blood flow or arterial blood from the umbilical cord. And also the consideration of the APGARs, which are a score that's given to a baby at the first minute and 5 minutes of life. A score of 3 or less can be used as supporting evidence for HIE. And the treatment for HIE includes hypothermic therapy, where the body is cooled to 91 degrees Fahrenheit in order to decrease cellular demand and limit the amount of lasting damage to the brain. Also, treatment will likely include ensuring adequate ventilation. So this could be through intubation, through blow-by oxygenation, through a nasal cannula, basically anything to try and support that respiratory system. Blood pressure stabilization, managing fluids, and treating seizures if necessary. Next slide. IVH, or intraventricular hemorrhage, is bleeding inside or around the ventricles in the brain. And I don't know how well you can see in the slide, but it shows like what the normal ventricles of the brain look like versus a grade 1, 2, 3, or 4 bleed on the brain. Grade 1 bleeds occur just in a small area of a ventricle. A grade 2 bleed occurs inside the ventricle. In a grade 3 bleed, the ventricles end up being enlarged by the blood. And a grade 4 bleed is when the bleed also occurs in the brain tissue surrounding the ventricles. This bleeding, while depriving appropriate oxygenation to newborn cells, also increases pressure on the brain, which can also cause neural damage. In cases of severe IVH, hydrocephaly may develop as well. And hydrocephaly is the cerebral fluid on the brain. The cause of IVH isn't clear, but it may be the result of oxygen deprivation, traumatic birth, or complications after delivery. Symptoms of IVH include apnea, which is pauses in breathing, bradycardia or slow heart rate, pale or blue coloring of the skin, weak suck or poor feeding, a high-pitched cry, irritability, seizures, swelling or bulging of the fontanelles, which are the soft spots on the baby's head, as well as anemia, which is a low blood count. There is no specific treatment for IVH except to treat any problems that may worsen with the condition. Next slide. So PVL, or periventricular leukomalacia, can occur primarily in premature infants and is the result of the death of small areas of brain tissue around the ventricles of the brain. And in the photo, I'm not sure if you're able to see it, there's like areas of gray around those dark spots in the middle, which are the ventricles. And that gray area is indicative of cellular death. It's thought that changes in blood flow to the periventricular areas of the brain, especially prior to 32 weeks gestation, causes damage and cell death. This area of the brain is fragile and easily injured, especially in premature births. The most common signs of PVL appear by 5 to 9 months in age and include physical and mental health delays, difficulty with eye movements, hearing loss and vision problems, learning disabilities, scoliosis, seizures, spasticity, especially in the legs, and urinary incontinence. This condition is generally diagnosed with ultrasound and an MRI of the head. There's currently no treatment for PVL as the cells are dead, and that is an irreversible condition. So next slide. There are several established risk factors that increase the chance that a baby may be born with or develop cerebral palsy as a newborn. And just because the baby meets one or more risk factors does not mean that they will develop cerebral palsy, but that it is just an increased risk. So first is prematurity, especially for babies born prior to 32 weeks. It increases the risk of development of CP due to increased risk for cardiac, respiratory issues, homeostatic issues, so maintaining the body's natural balance, GI complications, blood complications, and also complications with the immune system, and those all could lead to brain damage. Additionally, low birth weight is also a risk for cerebral palsy, which isn't surprising as the majority of premature babies tend to have a low birth weight. If a mother has a history of premature births, her provider will closely monitor her subsequent pregnancies in order to lower risk factors if possible, or implement preventative measures. Exposure to toxins, as mentioned previously, infections I'm including, can increase the risk for development of brain damage or malformation with the potential for development of cerebral palsy. A cerebral vascular accident or stroke that occurs during pregnancy or within the first month after birth is referred to as a perinatal stroke, which puts a baby at a significant risk for cerebral palsy. And a stroke is the result of blockage or hemorrhage of one or more blood vessels leading to the brain. This disruption of blood flow deprives the brain and the tissues downstream of oxygen, ultimately resulting in cellular damage or death. One study found that of 111 children who experienced a perinatal stroke, 68% subsequently developed cerebral palsy. As far as umbilical complications, umbilical knots and tight nuchal cords decrease blood flow to the baby, which would decrease blood flow to the brain and increases the risk for development of cerebral palsy. And some maternal medication or medical conditions such as type 2 diabetes, lupus, type 1 diabetes, and Crohn's disease can also increase the risk for cerebral palsy. And then medical negligence, basically if a provider doesn't or fails to recognize if something's going wrong during the pregnancy or the labor, the delivery, it could take longer to, what's the word that I want to use, intervene appropriately, and any length of time where that intervention is lost could potentially result in brain damage. So next slide. So there are 4 common types of cerebral palsy: spastic, dyskinetic, ataxic, and mixed. And I'll have you hit next. I think I might have set this up to be on a click. I did, sorry. I'll have you click through to the next slide. So the type of cerebral palsy that a person may have depends upon where that brain damage or brain cellular death occurs. So spastic cerebral palsy accounts for approximately 70 to 80% of all CP cases. And it's the result of damage to the motor cortex and or the pyramidal tracts of the brain that occur either before, during, or shortly after childbirth. Due to the location of the damage, this results in increased muscle tone, making for stiff muscles and jerky, awkward movements. And in that first picture where the orange is, that just shows the motor cortex. And then in the picture with the green and the orange, those are the pyramidal tracts that go down into the spinal column. And it's divided up into 3 3 types. So diplegia is when 2 limbs are affected. Hemiplegia is when half of the body is affected. And quadriplegia is when all limbs are affected by the condition. So next slide. So next up is dyskinetic cerebral palsy, which accounts for approximately 6% of all cases of cerebral palsy, and it results from damage to the basal ganglia of the brain. The purpose of the basal ganglia is to help control the body's voluntary movements, including speech, movement, and posture. The basal ganglia is also important in processing sensory input, which affects emotions and motivation, which also affects our ability to learn and form habits. There are 3 identifiable types of movement associated with dyskinetic cerebral palsy. And could you hit the next slide for me? The first is dystonia. So this movement is a result of sustained muscle contractures, which present as stiff posturing and hypertonia. This means that the muscle is really tight and resists passive stretching and movement. When the dystonic contraction is intermittent, it presents as slow and repetitive involuntary movements. This can cause problems with motor function, including speech, difficulties in positioning and posture, which can be painful, disrupt sleep, create orthopedic complications, and it's also important to note that the constant movement or contraction of muscle uses more energy and can result in malnutrition. And that goes for most forms of cerebral palsy. Next slide, please. So the next is athetosis movements, which are characterized by involuntary, slow, writhing movements that are seen mainly in the face and the hands. These movements are generally present during rest, but may worsen with intentional movement. This movement type can result in fluctuating muscle tone. So stiff muscle tone to floppy tone, facial grimacing or drooling, which is a result of the inability to control facial muscles. And this can also make it difficult to eat and drink. Athetosis may cause problems when a person tries to grasp or hold objects as well. And even though these muscle movements are present during waking hours, they typically go away during sleep. And next slide. Chorea movements are brief, irregular, and involuntary movements that have been described as dance-like, hence the description chorea, which you've probably heard before in terms of choreography, which is the art of making dances and the gathering and organization of movement into order and pattern. And it's just important to note these involuntary movements are most noticeable when a person attempts to move. So next slide. Ataxic cerebral palsy is a result of damage to the cerebellum, which is the portion of the brain that controls balance and movement. It also plays a role in language and memory processing. Ataxic movements are shaky. Fine muscle movements, such as those needed for writing or grasping small objects, are very difficult to control. Ataxic muscle movements can affect the hands, feet, limbs, eyes, and even speech. And also because of how important the cerebellum is for balance, it does also affect the ability of the person to be able to sense their body in relationship to space, which is called proprioception. And next slide. And last, which is kind of self-explanatory, is mixed cerebral palsy, which affects 10 to 15% of individuals diagnosed with cerebral palsy. And it's just what it sounds like. It presents as symptoms of more than one type of cerebral palsy as a result of damage or malformation to two or more of the aforementioned areas of the brain. Next slide. So diagnosis of cerebral palsy is a long process relying primarily upon symptom recognition, particularly in relation to milestone delays. There are some imaging studies that can be done to determine the location of damage or malformation in the brain, specifically in regards to HIE-induced cerebral palsy. Additionally, some imaging studies can rule out other underlying conditions that may be contributing to the cerebral palsy-like symptoms. An MRI can be useful in detecting areas of oxygen deprivation and subsequent cellular death, but it can take anywhere from 15 minutes to over an hour to complete the imaging study. And since CP is generally diagnosed at a very young age, it is often necessary to sedate the patient prior to the exam. Another study that can be used is CT, or computerized tomography, which takes only 15 to 20 minutes, but due to the need to keeping still for the image, again, sedation is often necessary. Another thing to consider for the CT scan is that it does use ionizing radiation, which of course is a risk to the developing brain. So that would be something that you'd want to discuss with a provider before doing. And then the last imaging study that I want to discuss is cranial ultrasound. This study is preferable for infants because it doesn't require sedation. However, it must be performed while the cranial bones are not completely formed. And that happens approximately between 12 to 18 months. After the bones have formed and knitted together, it's no longer possible to get that imaging study. And I just want to also mention that these studies are not used as a standalone for diagnosing CP, but they can help support a clinical decision for that diagnosis. And also another quick bit on milestone delays. Milestones are just an average of what we expect to see in children of a specific age range. And when a pediatrician is looking at developmental delays, they recognize that those delays can stem from anything. So if they suspect CP as a potential diagnosis, they'll likely refer the patient or child to be seen by a specialist, such as a pediatric neurologist, PMNR, or a physical medicine and rehabilitation doctor, or a child developmental specialist. At the regional center, when we determine eligibility, we look specifically to see if the client has been evaluated by a PMNR physician, as they are extensively trained in the diagnosing of CP. And then just a little bit about coexisting conditions that you might see along with cerebral palsy, just due to the nature of cerebral palsy being from brain damage or malformation, are seizures, hearing, vision, and speech disorders, and intellectual delays. All right, next slide. So now that we've kind of gone over what cerebral palsy is and possible causes and risk factors, I want to talk a little bit about the therapies that are available to help improve quality of life for individuals living with CP. And I also want to mention that the therapies and treatment are for symptom management only, as there is no cure for cerebral palsy. So next slide. So first I want to talk about physical therapy. The goal of physical therapy is for individuals with cerebral palsy to relieve pain, decrease muscle stiffness, as well as improve overall mobility. It can also prevent complications or lessen the severity of complications due to cerebral palsy. This is accomplished by strengthening muscles to prevent joint dislocation and improve the mobility, reduces the risk of developing contractures. The focus of physical therapy will be tailored to each individual's needs, but regular participation can help improve coordination, balance, strength, flexibility, endurance, pain management, posture, gait, and overall health. So next slide. And when it comes to orthotic devices, you may already be familiar with AFOs, which are ankle foot orthotics, but there are many other orthotic supports that are available. The purpose of orthotics for individuals with cerebral palsy, especially when they are children, is to establish normal or as near to normal movements of muscles and joints as possible. They help by creating a stable base for movement, as well as decreasing spasticity of the limb that the orthotic is fitted to. Orthotics also help reduce the amount of energy needed to complete a movement through stabilization. This stabilization also helps prevent deformity and can even help correct improper skeletal alignment. Not to mention, the stabilization that some orthotic devices provide can help prevent injuries and falls. As far as what orthotics are available, there are really too many to name. Basically, if there's a joint that needs stabilizing, there's likely an orthotic for it. If you think your client may benefit from the use of an orthotic, please address this with their primary provider and request a referral for an orthotic evaluation. If your client already has an orthotic, but it appears too worn or the client appears uncomfortable with it, request an evaluation to see if the device needs to be replaced. And even if an orthotic appears to be fine for the client, it's recommended that it's evaluated at least once every 12 months to make sure it's still fitting appropriately and working correctly. Next slide. So assistive devices and technologies. It's kind of amazing what advances technology has come up with that help our clients living with cerebral palsy have as much independence as possible. So first are the communication devices. Electronic communication boards and eye tracking devices are useful for individuals who are not able to vocalize their wants or needs. And as I mentioned before, hearing impairments are common or sometimes coincide with cerebral palsy. And so now they have cochlear implants can help with hearing for our clients. Writing and typing aids such as pencil or pen grips, weighted pens, slanted writing surfaces, and pointers that can help with typing on like a keyboard can be very helpful for our clients as well. I apologize for that. And other adaptives that are available are dressing aids or benches that are designed specifically for the client, safety bars, weighted utensils and servingware, adaptive scissors, reaching aids such as like a grabber, non-slip mats, positioning aids, and other adaptive DME are all other pieces of equipment that can be beneficial for our clients living with cerebral palsy. Next slide. When it comes to medication, the goal is symptom management, and there are quite a few different medication classes that you likely are already familiar with. When it comes to any medication that your client takes, it's important that you understand why the medication is prescribed for your client, as well as the possible side effects that accompany those medications. Next slide. So starting off with muscle relaxants. The purpose of this medication is to reduce muscle spasm and stiffness. If you've ever experienced a muscle cramp or spasm, you are aware that they are uncomfortable and can even be agonizingly painful. So making sure your clients have a muscle relaxant on board if they suffer from spastic cerebral palsy is essential. Some of these medications you may have already seen in care are baclofen and Flexeril. You may also see diazepam used, even though technically it's an anxiolytic or an anxiety medication. It also has properties to reduce seizures as well as muscle spasm. The fact that it can treat several different conditions at the same time is one of the reasons why you may see it more often than other medications in your clients who have cerebral palsy. Dantrolene and tizanidine can also be prescribed for the treatment of muscle spasms. A common side effect of muscle relaxers is lethargy and sedation, and some muscle relaxers can also cause dry mouth and constipation. There are many other possible side effects, so it's important that you familiarize yourself with each medication's own specific set of side effects. In regards to anticonvulsants, not all individuals diagnosed with cerebral palsy have a coinciding seizure disorder, but it is a common comorbid condition, as the damage to the brain that causes cerebral palsy can also lead to seizure activity. As a result, many individuals with cerebral palsy will also be prescribed an anticonvulsant. Commonly used anticonvulsants for individuals with CP are Depakote, Topamax, phenobarbital, and Keppra. An important thing to consider with clients who receive long-term anticonvulsant therapy is the significantly increased risk for osteoporosis. It's thought that some anticonvulsants inhibit the abilities or the body's ability to absorb vitamin D, which is necessary in order to absorb calcium, which is necessary for building and maintaining healthy bones. And I'll talk a little bit more about that later. But some other side effects that you may see with anticonvulsants are headache, nausea, vomiting, loss of coordination, sedation, and more. And again, just make sure you're familiar with the side effects of your client's specific medication so you can communicate with their primary care provider about anything you might be concerned about. And on to antidepressants. So next slide. Studies have shown that individuals diagnosed with cerebral palsy are at an increased risk for depressive mood and anxiety disorders. So it's not uncommon to see these medications prescribed to our patients. There are several different classifications of antidepressants with different properties that make them more or less effective in the treatment of depression and anxiety for our clients. And it generally becomes a case of trial and error in finding a medication that works best. Medications that you may see prescribed are Celexa, Lexapro, Prozac, Paxil, Zoloft, and more. Side effects that you may notice are complaints of headache, nausea, sexual dysfunction, dry mouth, which can lead to tooth decay, and even suicidal feelings, which seems counterintuitive, but sometimes some of these medications have what's called a paradoxical effect, where it increases symptoms rather than reduces them. And if that's the case, that's something to alert the doctor about immediately. It's also important to look out for signs of serotonin syndrome or neuroleptic malignant syndrome, both of which are medical emergencies. And symptoms of serotonin syndrome are headaches, nausea, diarrhea, fever, tremors, agitation, rapid heart rate, and high blood pressure. And symptoms of neuroleptic malignant syndrome include fever, tremors, difficulty with speech and swallowing, fast heart rate, fast breathing, changes in blood pressure, changes in level of consciousness, including confusion, lethargy, or coma. And I know these symptoms can be tricky to see in our clients with cerebral palsy, especially if they have lots of involuntary muscle movements or already have difficulties with speech and swallowing. In these cases, it's important to know your client's baseline and be alert to any changes from that baseline and seek medical attention when appropriate. Anticholinergics are a class of medications that can help provide some relief from issues such as involuntary muscle spasms, including the muscles in the digestive tract, tremors, decreased bronchial secretions, and excessive drooling. Medications you may see prescribed are benztropine mesylate, carbidopa levodopa, Robinol, and procyclinide hydrochloride. If your client is also taking an antihistamine, make sure the provider is aware that both medications are prescribed, as when they're taken together, they tend to amplify the effect of the other medication. Possible side effects that you may see or hear complaints of are blurred vision, constipation, dry mouth, urinary retention, decreased ability to sweat, among other side effects. And I just really want to mention that decreased ability to sweat is really important to be in on, especially this time of year when it's really, really hot. The inability or decreased ability to sweat can have a detrimental effect of our clients' ability to stay cool. For this reason, it's important to make sure they're in a cool environment. And just to remember that a fan is not effective if someone's not able to sweat because there's no moisture on their skin to evaporate to create that cooling effect. So just to make sure that, try and keep your clients cool as possible in that case. Next slide. So stool softeners are generally prescribed for individuals with cerebral palsy, as the disorder itself can cause constipation issues, as well as in conjunction with many of the other medications they're taking that also have side effects for constipation. And constipation that's left untreated can cause severe medical complications. So common stool softeners that you'll see are like Miralax or polyethylene glycol, lactulose, and docusate. A stool softener is generally a regularly scheduled medication to promote regular bowel movements, but there are times where those medications are not enough, and an as-needed medication is likely already ordered. But if it hasn't been, that would be something to talk to the provider about. And those would be like your laxatives, your enemas, or suppositories. And depending on what your facility's rules are on those medications, you may not be able to give like a lax or not a laxative, but a suppository or an enema. And laxatives that you might be familiar with are Seneca or Dulcolax. As with any medication, there are potential side effects, the most common being loose stools or diarrhea. And if you notice your clients having either of those issues, it'd be important to hold the medication and notify the provider or whatever your facility's policy is on that. Just to make sure that, if your client is having repeated loose stools or diarrhea, that could lead to an electrolyte or fluid imbalance, which could result in hospitalization. So that's a delicate balance. And then I also wanted to talk about proton pump inhibitors, or PPIs, which are used for the treatment of GERD, which is a common condition for individuals diagnosed with cerebral palsy. GERD is just a condition when the sphincter between the esophagus and the stomach is unable to prevent the reflux of stomach contents back into the esophagus. This is not only uncomfortable and sometimes painful, but it can lead to serious complications when the stomach acid eats away at the tissues of the esophagus, throat, or if it's aspirated. And repeat exposure of the esophagus to stomach acid can lead to a condition known as Barrett's esophagus, which is thickening of the esophageal walls. And a potential complication from that is esophageal cancer. Even though it's a small risk to develop that, it's important to ensure that clients with history of GERD are receiving medications to treat that. And those medications that you might see are Nexium, Prevacid, or Prilosec. Some possible side effects to look out for are bloating, diarrhea, headache, nausea, stomach ache, and constipation. In some rare cases, proton pump inhibitors can lead to cardiovascular disease and kidney disease. But as long as they're following up regularly with their provider, who's, I would hope, asking for or laboratory results, looking at labs, making sure that those organs are working appropriately. This by no means is a complete list of medications used in the care for individuals with cerebral palsy. For instance, Botox injections can be used to paralyze spastic muscles and provide relief from that spasticity. But I did want to go over some of the major classes that you're likely to encounter. Next slide. And I'm looking like I'm going to have to start rushing a little bit here. But these are some surgeries that you might see as like a history for any of your clients. A stereotactic radiosurgery is basically precise radiation beams that are used to treat lesions that are on the brain that could be causing some of the cerebral palsy symptoms. So it wouldn't be curative, but it could help reduce symptoms. SDR, or selective dorsal rhizotomies, is a neurosurgical procedure to treat spasticity with dystonia, in which small portions of targeted nerves are cut to improve muscle symptoms. But it's only generally done for individuals who already have the ability to walk some, or have good trunk support and are able to participate in the intense physical therapy that comes after. Tenotomies are the cutting of tendons, which can sometimes be performed to relieve pain and tightness in muscles, as well as reduce spasticity and improve muscle function. It's often only recommended in cases of severe contracture that has failed other less invasive corrective measures. Gastrostomy is when a surgeon puts a hole in the abdomen and into the stomach and places a tube into the stomach, which allows for supplementary or complete nutritional intake for clients who have difficulty swallowing. Fundoplication is a procedure in which a valve is placed at the top of the stomach to prevent backflow of stomach contents into the esophagus, which can help prevent complications from GERD, aspiration of stomach contents, which could lead to pneumonia, vomiting, and more. Submandibular duct relocation. So that is a procedure where they remove move the salivary ducts from the front of the mouth under the tongue to the back of the mouth, so that way those secretions can be swallowed more easily, to help reduce excessive drooling if other like medications or adaptive equipment are just not working. Bladder augmentation is also sometimes done for individuals who have difficulty urinating, and this is done by enlarging the bladder and also enhancing the control of urine output. And I'm not sure how common, but you likely have already heard of a baclofen pump placement. It's an option for individuals with spasticity issues. The pump is placed in the abdomen near the hip, where a catheter is threaded into the spinal cord to allow for continuous infusion of the medication into the spinal column to reduce the symptoms of spasticity. So next slide. So as I mentioned earlier, our clients are at an increased risk for osteoporosis due to the medications they take, if they're taking medications for seizures. And also one of the ways that we build bone density is through regular muscle use. And if our clients are not able to do like a lot of weight bearing exercises, they don't necessarily have that great bone density. One of the things you'll see is like vitamin D or calcium supplementation to help improve bone quality for our clients. Also recommended are DEXA scans, where they look at how dense the bones are to see how severe a case of osteoporosis might be. And something to consider with our clients who do have osteoporosis is their bones are very fragile. So it doesn't take very much to break them, whether it's a small fall or even just repositioning. If you have a client who you just moved them, turn them over, to help reposition them in bed, and all of a sudden now they're complaining of a lot of pain, it's very possible that just that small movement could have caused a fracture or some other complications. So if your client was normally not having any issues and all of a sudden is having behaviors or acting like they're in pain, that could be a sign that, possibly there could be a complication from osteoporosis, and a good idea to follow up with a doctor. Next slide. So bowel obstructions are also a complication that we can sometimes see in our clients. Generally, when we see a bowel obstruction, it's as a result of constipation that went too far. And that bowel blockage can result in backflow of stomach contents, which could result in aspiration and a pneumonia. And that bowel obstruction could also lead to more complications like bowel death, which could result in needing to do a colostomy, which is a major surgery and can drastically change, your client's life. They may end up having to move to a different level of care. So anytime you have a client who hasn't had a regular bowel movement, it's important to be very on top of that and making sure that we're preventing bowel obstructions at any cost. So next slide. Hip dislocation and arthritis of the hip is also a possible complication with our clients, or just basically any joints in general. And this is because of the muscles not forming necessarily properly, and so the joint's not supported very well, and so it can easily dislocate. So that's also something to consider when repositioning your client, that, you know, there's always a possibility that a joint could become dislocated from just a repositioning. And then also, if physical therapy is not used to maintain the mobility of the muscle, that can cause problems as well. Next slide. So injuries from falls, and kind of also related with osteoporosis here, aside from just regular injuries from falls, just due to the increased risk for fracture, that's just something to be very aware of. That our clients with severe or with cerebral palsy, especially severe cerebral palsy, are, you know, more fragile and more likely to, are more at risk for injuries from falls. So anytime you have a fall, make sure a client gets seen by a provider. Next slide. And then pressure injuries, these can result from an impaired movement. If a client's not able to reposition themselves in bed or, you know, in their chair, they could develop a pressure injury. And next slide. Also, joint contractures can lead to pressure injuries. Just wanted to mention that, like, if a contracture is so severe that like parts of the body are rubbing against each other, that can cause a pressure injury. And joint contractures are a result of increased muscle tone. And if physical therapy is not used to maintain mobility, you might not, that joint might not be, might become frozen. And this can be definitely problematic, especially with hands, where fingers can dig into the hand and create wounds. And the contractures can also lead to pain, sleep disturbances, and deformities that can make it difficult to access care. So if a client is severely contracted and can't fit into like diagnostic equipment, sometimes conditions may go unnoticed or undiagnosed for a while. Next slide. And then pneumonia is also another complication due to risk for aspiration or inability to clear the airway. Another complication, next slide, is poor nutrition due to the inability to swallow or inability to absorb nutrients through feedings. Next slide is scoliosis. And this is a result of altered muscle tone, and it can lead to a lot of back pain. It can also lead to breathing complications in severe cases, and even spinal or nerve damage. Next slide. Seizures, as I mentioned before, also can be a complication associated with cerebral palsy just due to the brain damage. And the seizures can result in like aspiration or permanent damage, such as a stroke, injury from falls, biting, or bumping into surfaces during a seizure, and complications from medication. Next slide. And there's also the social stigma. Some people just don't know how to interact with individuals with cerebral palsy and can sometimes talk down to them, and just not comprehend that just because someone is having a muscular problem does not necessarily mean that they are, intellectually delayed. Next slide. Also important to note is our dental considerations. You can see here the effects of teeth grinding due to cerebral palsy can really lead to poor dentition. Also, alterations in salivation and bone loss, like from osteoporosis, can make it hard or cause lots of complications. So it's really important to maintain regular checkups with a provider. Next slide. So just considerations after all of that, just be aware of how you interact with your clients. Cerebral palsy does not correlate to profound intellectual disability. It's important to learn who your clients are, what they like, and engage in meaningful interactions with your clients. And as far as social interactions, we're social creatures for the most part. So it's important to assist your clients who may have difficulty accessing the community and creating outings that are stimulating and rewarding. And equipment, I definitely glossed over this earlier, but there's a lot of equipment available to assist you and our clients with their daily living, including Hoyer lifts, adaptive wheelchairs, standing walking frames, etc. I mean, they're all important for the care of our clients. And if you've noticed or do notice there's something wrong with their equipment, or you think they may benefit from a new piece of equipment, reach out to their DME provider for an assessment to see if there's something else they may benefit from. And if you're having a problem with getting DME repaired or replaced, or just getting new equipment, please reach out to either your client service coordinator, or you can reach out to our nursing team for assistance. Next slide. So that is what I have for you today. I've added some resources here if you are interested in looking into this a little farther. But does anyone have any thoughts or comments or questions? I know I'm cutting this pretty tight. All right. Well, thank you very much for attending, everyone. Yeah, I appreciate it. And then again, this video will be uploaded to our YouTube channel shortly, or actually, I'm not sure how long it will take, but it will be uploaded eventually.